Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. This is Joan Buckley from the Nursing Department here at Nassau Community College. Today we're going to be speaking about chronic pain, and we're going to be speaking to Cindy Perlin, who is a licensed clinical social worker as well as a certified biofeedback practitioner. She's a chronic pain survivor, and she's the author of a really great book, The Truth About Chronic Pain Treatments, the Best and the Worst Strategies to Becoming Pain-Free. Cindy is an expert in helping patients find safe and effective relief, so I want to welcome to the show Miss Cindy Perlin. And this is the voice of Nassau Community College, 90.3 WHPC. And let's say hello. So, Cindy, can you just introduce yourself and just tell us why there's this interest in chronic pain and not just pain? Why chronic pain? But a little bit about yourself.
Well, my interest in chronic pain grew out of being in chronic pain for 3.5 years. When I was 25 years old, which was 40 years ago, and doctors weren't able to help me. I hurt my back, and nobody could figure out the reason I was in pain, and that went on for a very long time until I stumbled on something that would help, which was biofeedback. And, since that time I've had several bouts of long-lasting pain. Chronic pain is pain that lasts more than 3 months. So I've had pain that's lasted many, many years. And each time that happened, the conventional doctors weren't able to help me. So I was able to find help alternatively. And I became interested in teaching people about that so they don't have to suffer as long as I did.
Now, how did you become a licensed social worker? How did that play? What part did that play in this new role or this really passion of yours now with chronic pain?
Well, I was in graduate school for social work when I hurt my back, so I was headed in that direction. And I had to delay my degree for quite a few years. I eventually finished it part-time after going back to work. And it did change the direction of my work. I was doing administrative work, and I decided to leave that and work with people and groups and one-on-one, helping them with pain and other types of chronic illness.
Now, when you talk about the chronic pain experience that you had, and you had it at a very young age and a very crucial time, but you completed your life goal and you work with people. That is you. You work with people. You're a social worker at different levels. But why write a book? Why write a book about the truth about chronic pain? I mean, you mentioned that your doctors couldn't find the relief you needed, and you went to biofeedback. But why write a book about it? That's over the top. Yeah.
To reach more people. As a clinical social worker, there's only so many people that you can work with one-on-one, and it's a message that I wanted to get out, that there is help for chronic pain. You don't have to stop with what your doctor offers you, and there's so much more. So I wanted to let people know about that, and also about the dangers of conventional care, because there isn't any pharmaceutical use for pain that's safe. They all have serious side effects. We know about opioids and addiction. Opioids also increase your chances of auto accidents and falls, reduce your immunity. They have many other negative side effects. The nonsteroidal anti-inflammatory drugs can raise your risk of intestinal and gastric bleeding, and that can be fatal. You can also increase your risk of heart attack and stroke if you use nonsteroidal anti-inflammatory drugs for more than a few weeks. So there really isn't a good alternative in conventional medicine, but there's plenty of alternatives in alternative medicine.
So you talk about conventional and alternative. Can you explain, you did talk about conventional. Can you explain a little bit about the alternative? You said you use biofeedback. Can you start with that one? Because that seemed to be the most positive for you in a very critical time of your life.
Well, that was most helpful for my back. So what biofeedback is it uses sensitive electronic instruments to measure something about your physiology. So it could be muscle tension, blood flow to your extremities, brainwave activity, skin moisture. And all of these things can be brought under voluntary control if you have the information. So by measuring things like muscle tension, or in my case it was just blood flow to my hands and hand temperature, if you measure that and then you practice different techniques to change that, you actually can learn how to control your body. And it can be very effective. In my case, it was very effective for my back pain. What I was working with hand temperature was basically relaxation skills. The more relaxed your body is, the more warm your hands are. So if you can warm your hands internally using your mind, then you are relaxing your whole physiology. And that was critical for me because I was in a real pain cycle where I would hurt, I would worry about the pain, that would make the pain worse, and then I'd worry some more, and I was able with biofeedback to get out of that cycle and to learn how to relax.
Now you said that you were in pain for over 3 months. That's what the label is for chronic pain, is pain that you have greater than 3 months. What was
yes, but right? I was in pain for over 3.5 years.
Was that before you started using alternative therapies?
Yes.
Oh, wow. So
yeah, I knew nothing about them at that point in my life.
Wow. So you were going through the conventional for 3 years, and then
right.
Did you find an alternative therapy, or did you get someone suggested to you?
Well, fortunately, I had a friend who is a health reporter, and she came across a book about the mind-body connection that she suggested that I read, and it mentioned biofeedback, so I decided to try it. And after my first session, my pain was reduced by about 50%.
Wow. You know, you're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the nursing department here at Nassau Community College, and today we're talking about chronic pain with Cindy Perland, who is a licensed clinical social worker, but also a chronic pain survivor and author of the book, The Truth About Chronic Pain Treatments. So now you're saying that you really, so conventional medicine, those doctors aren't always the first ones to offer an alternative. Did you feel that they were treating your pain at all? Like you said, it went down 50% with the biofeedback treatment the first time. Did you get any relief other than just the stuff you talked about before, the anti-inflammatory effects and the narcotic effect? Had you had any relief in that 3-year period? Because that's a long time.
No, not really. The medication really didn't seem to make any difference in my pain.
Wow.
And doctors were saying to me, one doctor said, there's nothing I could do, I don't know what's wrong with you. He's a well-respected orthopedic surgeon. He said, you may have to be like this for the rest of your life. And I was only 25, and that's not something you want to hear.
No.
So fortunately, I stumbled upon something thanks to my friend, and that made all the difference in the world. And then a few years later, I had some foot surgery for a bone spur in my foot, and it took me 14 years to find a solution to that, because in that case, the mind-body approach and biofeedback wasn't helpful.
So what helped you?
And then what I found was a hands-on technique, a type of very deep body work called Rolfing. And within 2 sessions, I felt like I had a new foot.
Oh, my goodness. Now, you do not sound like you are anti-conventional medicine at all, but it is something that you went for 3 years. You're an educated young woman, and you went for 3 years. Do you find that that's pretty common in people that you've met or that have talked to you since you put out this book about having chronic pain?
Yeah, people have chronic pain sometimes for decades. And, they get prescribed drugs, but even if the drugs give them some relief, it doesn't really solve the problem because drugs just cover things up. And when they wear off, you're back to square one. And alternative treatment is more about getting to the root of the problem. So it could be a muscle imbalance, it could be chronic stress or a history of trauma, it could be a nutritional deficiency. There's many things that can happen that cause chronic pain, and the drugs are not doing anything to fix the cause.
So what is your recommendation to someone that contacts you? I mean, you're in contact with a lot of people as it is, but you also have this book. And so as an expert in chronic pain, what is the first thing you would recommend to a person? I mean, you do need to know that it's not something physiological that needs to be fixed, correct? Is that what you would still recommend, that they start with a physical exam and their primary care?
Yeah, I think that that's a good idea. But don't stop there, because if you're not getting any relief, there's plenty of more things out there. And I just want to mention that since I wrote my book, I've also created a website, an alternative pain treatment directory. It's paintreatmentdirectory.com. And that website also has a lot of information about alternative treatments, and it has helpful products, most of which most people have never heard about, and also lists providers who do alternative pain care.
Now, do you work as a team, or do you work with people just still one-on-one? As a social worker, it's a one-on-one usually, or you're part of a team. But now, how do you interact with people now that have chronic pain? Is it totally through your website or your book?
Well, I do have a clinical practice still, and I do phone consults for people who aren't in the area. I can go through somebody's pain history with them, including their treatment history and the kinds of resources that they have, and then make recommendations for things that they probably haven't tried that would be helpful for them. So whether it's in my office or over the phone, I can do that.
Do you get referrals from primary care physicians that know that you're there and know that the website has plenty of alternative medication therapies? Do you get private referrals from primary care physicians?
Not usually. I find that primary care physicians do not usually refer for alternative treatment.
That's so funny. Even when they say that you have to just live with this for the rest of your life. Like you would think what the harm.
Yeah, in fact, there's an interesting story about that, which is that I felt that physician who told me that was a care and compassionate medical provider.
Sure.
He just didn't have anything to offer me. So maybe 15 years later, when I'd been doing this for a while, working with people, I sent him a letter and I said, I saw you, I appreciate your compassion, you couldn't help me. Now I found a way not only to help myself, but I'm helping other people, and I'd like to talk with you about, patients you might be able to refer. And he refused to talk to me.
Oh, well, you know what? I think sometimes when you can't fix something, you do kind of feel that it's best to just stay away from it. But let's take a quick break. My name's Joan Buckley from the nursing department here at Nassau Community College, and today we're talking about chronic pain with Cindy Perlin, who is a licensed clinical social worker, a chronic pain survivor, and the author of a wonderful new book, The Truth About Chronic Pain Treatments. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
1 in 3 adults in America have prediabetes, but most don't know it. To let people know it can be reversed before it becomes type 2 diabetes, professional basketball player Julius Randle is doing everything in reverse.
I'm only dunking with reverse windmills. I drove the whole way to practice in reverse. I don't recommend it. This move's called the reverse shuffle. I do recommend it. And it took me months to learn how to speak in reverse, like this. Years 10 almost for diabetes type 2 with living Ben has mama. In other words, my mom has been living with type 2 diabetes for almost 10 years. So together, we want to say to the 84 million Americans at risk, exercise and healthy eating can help reverse prediabetes. Start by taking a simple 1-minute risk test at doihaveprediabetes.org.
Brought to you by the Ad Council and its Prediabetes Awareness Partners.
Bet he can't say that in reverse.
We now return to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thanks for being with us today. This is Joan Buckley from the Nursing Department here at Nassau Community College, and we're talking about chronic pain with Cindy Perland, who is a chronic pain survivor, a licensed clinical social worker, and the author of a new book, The Truth About Chronic Pain Treatments. So, Cindy, before the break, we were kind of talking a little bit about you and why this became such a passion for you that it took you into writing, and not just writing one book, but you've written more than one book, and we'll talk about that in a minute. But I just want to recap what we've talked about so far for our listening audience. So first of all, we say most people go to their primary care for pain management if they have pain that they can't fix with a Tylenol or something like that. And then sometimes there is nothing else that a primary care can offer, and they reach out to alternative medicine. And you hear it all the time: chronic diseases, chronic pain. So how does that work? When you find something that works, like you found biofeedback, do you develop a relationship with anybody? Is there anybody that works as your guide? Or is it you? Are you working as the guide, having the opportunity as a social worker to kind of keep people on the straight and narrow so they don't get distracted?
Well, I do refer out for other kinds of alternative services that I can't provide, things like acupuncture and massage, physical therapy, if I think that that's what people need, nutritionists. I have some knowledge of nutrition, but not as much as a nutritionist might have. So where I see a need to refer out for services that I can't provide, I do that. I do find that one of the most ignored interventions when it comes to chronic pain is the mind-body connection. When people are stressed, when they have a history of trauma that they haven't resolved, those things can really feed into chronic pain. Even if it's not the cause of the pain, it can make things much worse. So I try to coordinate things with other providers when needed. There's a lot that I can do myself. I find that I've discovered a lot of tools that people can buy and use at home, different kinds of topical treatments, massage tools, light therapy. There's low-level laser therapy that's very effective for pain. So I can introduce people to a lot of different tools that they can use on their own. And, where I can't provide a service, I do tell people about other kinds of services I think that can be helpful.
How could you teach me about the mind-body connection and utilizing that to relieve some of my pain?
Well, one of the best ways to do it is to hook you up to biofeedback and have you, first of all, take your baseline measurements. So if you're somebody who has cold hands all the time, chances are that's not a circulation problem. It's chronic stress. And I find that a lot of people have that very simple indicator that they're not relaxed. And when you're not relaxed most of your day, your body is not working optimally. It's preparing for fight or flight. Your digestion is suppressed. Your immune system is suppressed. Your muscles are tense. Your respiration is overly fast. All of these things can make you sick in the long term. So the first thing is to acquaint people with what their body is doing and how stressed their baseline is. Another thing that I always ask people is what their stress is currently and what history of trauma they might have. Because almost always when you see somebody with a chronic illness, including chronic pain, you'll find that they have a lot of stress or trauma that they're dealing with. And working that through can make an incredible difference for people.
So my hands are very hot all the time. If I put my hands on someone's shoulders, they say, "Oh, your hands are hot, get them off me," that kind of thing. So I'm going to put myself as pretty relaxed. But this is really very interesting because it's something that I think anybody could benefit from, not just someone that's chronically in pain, but anybody could benefit from this biofeedback. What's the next thing that you would recommend for someone that was doing okay with biofeedback, but they still needed a little bit more of a push to really get their pain managed?
Well, it depends so much on what kind of pain they have. From the mind-body realm, I also work with a technique called energy psychology. Mm-hmm. And it's where you would think about something upsetting and you work on yourself, usually with tapping on the energy meridians in your body. And what that does is it dissipates the emotional energy from past stress or trauma. And that can really help. So I do a lot of that with people. I do neurofeedback, which has to do with calming the brain. So if people, even without a trauma history, if people have been in chronic pain for a really long time, their brains change, and their brains are always on hyper alert and oversensitive to stimuli. So I work with that.
Wow.
There's also, as I mentioned before, issues with nutrition, vitamin D deficiency, magnesium deficiency, omega-3 fatty acid deficiency. All of those things can contribute to pain.
Wow. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the Nursing Department here at Nassau Community College. And today we're talking with Cindy Perlin, a licensed clinical social worker, a chronic pain survivor, and author of the book, The Truth About Chronic Pain Treatments. So now, you wrote the one book. You wrote another book.
Actually,
you're in the what?
No, I've only written one book. I have another one
coming
in
up.
Process about medical marijuana.
Yeah, can you talk to us about that? How to safely use medical marijuana to feel better? Because I know it's very controversial, even though bills are being presented, and some people are saying buy the stock. Tell us about why you even considering a book on the safe use of medical marijuana.
Well, because marijuana is an excellent pain reliever. It's an excellent anti-inflammatory. And contrary to what the authorities have been saying for decades, it's actually very safe. We know that marijuana has been used all over the world for thousands of years, and there's not one documented case of a marijuana overdose. And it's not physically addictive. Some people get emotionally addicted to high THC marijuana, which gives you a high, but it's not the same as a physical addiction. People don't rob banks to get a dose, to get a fix. So compared to opioids, it's extremely safe. The thing about marijuana is that it has components in it called cannabinoids that our body makes naturally to deal with stress and injury and to return our body to balance. Marijuana and its close relative hemp are the only plants we know of that have those components in it. And so when we take marijuana, and you don't have to smoke it, you can take it in a tincture, you can take it in an edible like a gummy, you can use it as a topical on your skin in the area of pain. When you use marijuana in any form, you're giving your body something natural that it's probably deficient in.
That's interesting. Have you ever used the medical marijuana for your chronic pain? I know you kind of got it under control with the mind-body structure, but did you find any one form of medical marijuana something that you found very helpful for your upper body
I seem
stuff?
to be averse to smoking, so I tend to use edibles and tinctures.
Okay.
And if people can't get medical marijuana, they can get CBD, which is legal everywhere and much more easily accessible. So I like edibles. The difference between inhaling and eating marijuana is fairly significant. When you inhale, and you can smoke or vape just heats up the marijuana so that you just get the beneficial components and you don't burn the leaves and get the less beneficial components. So when you smoke, it goes directly to your brain and you get an almost immediate effect. Within less than a minute, you will feel the effect when you smoke it. The effect's also short-lived. When you eat it, it can take an hour to have an effect, but the effect lasts much longer.
So does it have an effect on safety for the patient? At all? Are you able to drive with the other forms of marijuana?
Driving is kind of controversial. There have been studies coming out lately that say that marijuana does not impair driving to the extent that it causes accidents. There was just a large Canadian study that came out that looked at all of the accidents involving fatalities and compared the responsible driver to the non-responsible driver and found that opioids contributed to accidents, but marijuana does not. Having said that, I think that there's reason to be cautious if you're not used to taking anything and see if you feel alert and if your reflexes are as good as usual before you get in a car and drive.
Now, Cindy, before we end the show, what would be a takeaway message that you would want the listening audience to have regarding chronic pain and what's out there for them?
Well, I think the most important thing is don't lose hope. There's something out there that will help. Even if you think you've tried everything, there's something you haven't tried that will probably help. And I want to encourage everyone to go to my website, paintreatmentdirectory.com, and look around and find out about all the different things that are out there that can help.
Cindy, I want to thank you for being here. Again, this is Joan Buckley from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.